So we can do the imagination of whole body even on the backside. And that is a scientific. It's not given right now. This is in the practice since 2500 years old in the TCM. So we can do the imagination of whole body in the backside. The imagination of whole body in the backside means we can do the imagination of whole body like this on the backside. So we can do the imagination of both the lungs here, and we know definitely in the front part we have lungs, but even we can treat the lungs from the backside. We can do the treatment of the heart from here. So suppose these are the lungs and this is the heart. We can do the treatment. We can do the treatment of the liver, liver, gallbladder, spleen, and stomach from the middle part. Because we know in the middle part we already have these structures, and from the lower part we can treat the intestine and the genital part. So whatever is or whatever organ in the front side, the same organ we can treat from the back side while doing the guasa here. So look at this image, and we can see there is a lungs in the upper part, even the heart in the upper part. So we can see the lungs and heart is located here. So this is the front and back correspondence. Whatever organ in the front side, same will be in the back side. So where our scapular bone is ending, we can see this is the liver, gallbladder, stomach, and spleen. Liver, gallbladder, stomach, and spleen. So we can do the treatment from here. So where our ribs are ending, now we can treat the kidney, we can treat the large intestine, we can treat the small intestine, we can treat the genital part, we can treat all the organs. So whatever is in the front side, the same organ we can treat from the back side. I will show you practically. So these are the channels flowing in the back side. Look at this channel. This channel is starting from here on near the eyes. Then this channel flowing on the back side. We can see there are multiple points. There are multiple points. If you are treating the upper points, they are called upper back-su point. They are treating lungs and heart. If you are treating the middle point, they are called middle back-su point. They are treating the liver, gallbladder, stomach, and spleen. And if you are treating the lower point, they will treat intestine, small and large intestine, kidney, urinary bladder, and the genital part. So when the TCM practitioner do this practice, they are writing the name of the points, but here no need to write the name of the points. Just do the treatment here. So there are multiple lines. One line who is located in the center, we can treat this line. One line just 1 centimeter away from this, we can also treat this line on the both side. Then one line is available 4 centimeter away, one line available 8 centimeter away. So the whole back is full of points. So we'll tell the person fold the hands. So we can see this scapula bone. This is the scapula bone, and we can feel the lower border of the scapula bone. So if we draw the line at the lower border of the scapula bone, this line. So this line at the lower border of the scapula bone, this is the part 3. So here we can do the treatment for the lungs and the heart, right? So when we do the treatment, the most sensitive area till the forefinger on the right side and the forefinger on the left side, this whole area is very sensitive. And so we can do the scraping in this whole area. Now suppose the person is having some lung disease, lung problem, or the heart disease, heart problem. So we can apply the Guasa oil here. You can see this area turned red. So when we are looking this redness, we are getting scared. Wow, what happened? Why this area turned red? But it's a normal thing. It's not the problematic thing. It's the normal thing. More the pathogenic heat, more the problem, more the redness. Namaste.
Sir, अभी जैसे ये रेड हो जाता है, तो आफ्टर हाउ मेनी डेज वी कैन डू इट अगेन? कैन वी डू इट नेक्स्ट डे? तो फिर वो उस पे ब्राउन ब्राउन स्किन आ जाएगी ना?
Moxa will do minimum after 7 to 10 days on the same part.
Guasa.
Sorry, guasa. If you want to do the guasa, then you can do on the different location. Suppose on sometime you told the patient, okay, I will do the guasa in the back. On the other sitting, you can choose some different body part. You can choose the palm, you can choose the feet, but you can't do the guasa on the same location for minimum 7 to 10 days. See what will happen, I will tell you. Even I have done after the 7 days. So the first time patient will be feeling very good. Wow, very good treatment, doctor. Thank you so much. If you do the 7 after 7 days, then okay, then person will be tell doctor, the person will be feeling little irritability in the skin, right? Irritability, because still little more time need to get healed completely. So give the perfect break of 10 days, then do the guasa, and you will see the wonderful results. So the patients, if you want to do the some treatment, then you can do guasa once in 10 days, or if you have done very mild guasa, then once in 7 days. Then you can do some other treatment. Do not do guasa.
No, like cold and cough.
Yeah, suppose someone is having cold and cough today, you have done the guasa, and then you can do the acupressure, acupuncture, some other therapy to and on the remaining days, even on the day of guasa. So suppose one patient came on the 13th July, we have done guasa, but and we also have done the acupuncture or acupressure or some therapy. Then on the 14th July, we just can do the acupressure, acupuncture. On the 15th July, just we can do the acupuncture, acupressure, but don't try guasa every day. It's very effective, but it need little break in between.
So second question is that we need to go, means whatever organ we are treating, but still you did it in the small strokes, or can we go for long strokes also?
Yeah, like, so it depends on our comfort. Like because when I am doing guasa, I am making, because I am doing the movement of wrist. Okay, so just I am doing like this because I am making the movement of wrist. But if you are comfortable and you are able to do perfectly, even you can choose the big area, no problem. It's depend perfectly on your comfort. But hold the guasa with a 45-degree or the 30-degree angle and do this. Like see, when the person is doing the practice of tennis, when we are playing the tennis, then the coach is telling you how to hold the racket and how to hit the ball. Okay, it will make, otherwise ball will go out of the like lines and all. In the same way, when you do the guasa, first try to do with the wrist grip. It will create the very wonderful pressure, and slowly you will realize that now you are doing a very wonderful guasa. Okay.
And one more question, sir. Like whatever organ we are treating, we are not, supposed to move near the backbone only, or we can go like in the sides of the body also?
No, we can do anywhere. It should be like points. It should be point as per our correspondence. It's not like the near the bones. No. See, there is a concept. There is a concept. If you are treating near the bone, it will work on the bone. If you're treating on the muscle or near the muscle, it will work on the muscle. So wherever you work, it will affect the same part. Like suppose someone is having bone problem, someone is having arthritis or the degeneration of the bone. So better to do the scraping near the bone. But forget this, just we have to do on the area, whether the bone, whether the anything is there, right? But do not hit the bone too much. If you are hitting the bone, then bone will be painful, but you can do the scraping in between two bones. Like we are having two vertebrae or we are having two knuckles. So in between the knuckles, we can do vigorous scraping. But if we are hitting the knuckle, we can do the gentle scraping. But if we are hitting the knuckle too much, it might be painful. Yeah. Any question more?
No, sir. Thank you.
Okay. Yes. Gurudeep ji, yes, please. अनम्यूट करिए. हाँ, यस प्लीज. आपकी आवाज नहीं आ रही गुरदीप जी. किसी को आ रही है? नहीं आ रही, नहीं आ रही. गुरदीप जी आपकी आवाज नहीं आ रही है. अनम्यूट करिए, वापस अनम्यूट करिए. अनम्यूट अगेन. या नहीं, फिर से नहीं आ रही है. नहीं, नो, नो वॉइस. एक काम करिए, आप अपना स्पीकर ठीक करिए, तब तक हम बात करते हैं और लोगों से. कविता जी, यस प्लीज.
हेलो सर, आवाज आ रही है?
जी बिल्कुल.
सर, जैसे साइटिका किसी को कोई प्रॉब्लम लेके आ रहा है, साइटिका की बैक पेन की, तभी हम ऐसे स्ट्रोक दे सकते हैं पीछे बैक में?
हाँ हाँ बिल्कुल, बिकॉज ये साइटिका नर्व कहाँ से स्टार्ट होती है? साइटिका नर्व लंबर 4, लंबर 5, S1, S2, S3 से ही तो निकलती है.
हाँ
Okay,
जी.
so definitely we will give the stroke on the lower back, whether the sciatica pain or the knee pain or the heel pain or any pain which is happening in the lower part of the body. We are giving the stroke because this is the lower back which we have seen today. It's not only for the lower, it's the whole lower body.
ओके सर, लेग्स में भी इस तरह से जा सकता है पूरा अगर जाए तो?
Yes, yes, definitely. Leg में हम समझेंगे, leg के points पर हम करेंगे, जैसे like under the feet we are having the points, so we will do on the points, right? But if
Yes,
you
yes.
want to treat the sciatica pain, then uh, it is not necessary that do the on the root of sciatica. No, we have to do on the points, like the lower back, and even we will do in the feet. We will discuss. है ना?
सर,
Yeah.
जैसे आप बैक में ये पूरा बताया ना कि ये जो फ्रंट बॉडी है वो पीछे आपने लोकेशन करी है, तो
हाँ.
कोई जैसे प्रॉब्लम बैक की भी है तो मतलब कोई नॉर्मल कोई दिक्कत नहीं है, हम उसको बैक भी कंसीडर कर सकते हैं फ्रंट वाली
Yes,
बॉडी?
yes, yes, yes. Suppose there are lots of person having lower back pain. We are doing Guasa in the lower back itself, and they are getting benefit. On the local area, we are doing Guasa. They are getting benefit because see, lower back is the full of points. The back two point means wonderful point, and they create excellent results. So we can always do that, right?
थैंक यू सर, थैंक यू.
Yes, Selva ji.
Sir, actually, can we do the cupping and guasa together? First, we can do cupping, then followed by guasa.
See, the thing is this, like it might be becoming a very vigorous treatment, because even if you are doing the cupping, and suppose if you're doing the cupping massage, right, you are putting the cup and scrape and pulling the cup, then the person always there is too much redness, then it's not recommended to do the guasa, because it might give the very discomfort and painful feeling. So what I recommend,
Sir.
do the treatment in the different timings, like one treatment today and one treatment after 1 week or 10 days.
Okay, sir. And second question, say, sir, generally you asked you to find the last rib, the back, to find the abdomen, right? But for person who is very fat, we cannot find the rib for them. So is there any
Yeah, we can find with from the side. If you go from the side, you will find it.
Sir, 2-3 patients, they're very fat. I can't even find any bones on them, sir, actually.
Yeah, so no problem. From the buttock, you can go up. From the buttock area, you can find the buttock or not.
Yes, sir.
So from the buttock, you can go up. So near about 8-finger area, 8-finger area is the lower part.
Okay, sir.
Yeah, so there is no problem with that.
And sir, the deep scrapping, you said about deep scrapping, when it is needed, sir?
We can do the deep scraping in the back part, because back part is very strong and hard. So see, if someone is hitting on the back side, we can wear, but we can't wear in the front side. Front side is very sensitive. So in the back part, we can do the deep scraping. So if the person is, because see, why I'm not telling you right now to do the deep scraping, because people are very scared with the pain. So don't do any treatment which create too much pain. But as per the capacity, as per the condition, you can do the guasa. And one more thing, the person having more problem, the redness will be more. Okay, if the person is having blood stasis, and you can see it will not be red mark, it will be purple marks on the back. So you will see, because I have caught that the person is a healthy young person, so he's not having any problem. Okay, even he's but if you take some patient, immediately you will see lots of redness and the purple marks and all, right?
Okay, sir. And sir, from the center, how many centimeters left and to the left and right we have to do that
Never
scraping?
forefinger right and forefinger left, because this area is highly sensitive. Highly sensitive. In the acupuncture language, we can tell from the center, 3 chun right side and 3 chun left side. Or if we talk about as per the finger measurement, so forefinger right side and the forefinger left side.
Okay, thank you, sir.
Welcome, ji. Okay, Sagri Raghavanji.
Yes, sir. Can you hear me?
Yes, yes.
Yes. Now we divided the back into 5 parts.
Yeah.
Now, and corresponding to different organs.
Yeah.
Now you said don't do guasa every day, but once a week or 10 days gap. Now, supposing we treat the lungs one day, can we do the say the liver and the second part the next day?
Yes, yes. You're absolutely right. Yes, we can do. That's why I told you. Because see, why we don't repeat guasa very frequently? Because after doing the guasa, we have done the scraping, right? So we cannot do the scraping on the next day, but we can choose the different part. It's a really very good approach what you're thinking. Today we have done on the lungs, on the upper part, and in the second day we can do the stimulation of the middle part. On the third day we can do the stimulation on some other part. In that way, you even can repeat the guasa every day. There is no problem. Why we are not doing? Because we will not irritate the same part every day. Okay, that's why you can do that. Yes.
Yes, sir. Because when we are starting, it is very difficult to do the whole back. You know, that is why I asked.
You're right. You're right. You're absolutely right. But sometimes, yeah. So because see, if someone is suffering with the flu, we will do only in the upper part. We will not go in the lower part, right?
So and we'll do the parts which you showed the other day, the lungs and those parts.
Yeah, I will combine the protocol because it's still that pending. Okay, I will combine the protocol because we have protocol. So do the here, and stimulate all the, because you know if you know the 11 microsystem, and you just have to do the quickly on the lung microsystem everywhere, and you will see the wonderful results immediately.
Yes, sir. Thank you.
Welcome. Yes, Geeta ji.
Pranam, sir.
Yes, Pranam ji.
Sir, I just want to know whether we can do on a healthy person also or not.
No, definitely we are doing to a healthy person. Yeah. Because see, guasa is very wonderful to improve the circulation and improving the chi. Now, even the healthy person having lots of problems. Like, see, we are asking the person, okay, are you having cough? He telling no. But then we are doing some process, then person is spitting the cough out. From fear, cough is coming out. So we are having, even the healthy person is having some problems, little bit problems, toxins in the body. But why we are telling him healthy? Because right now he's not having disease, but in the future it might be having. So this is the prevention. Do today and make the health perfect. Okay.
Definitely. Thank you, sir. Second question is for self, we cannot do this, no?
Definitely.
Someone has to do
why?
For us.
Why we can't do? Wherever our hand will reach, we can do. Yes.
Only that area we can do.
Yeah, we can do, or we have to then arrange some rough guasa and keep on the floor, then lie down and do like this.
Okay.
We can do the guasa. We can do. We have to think. Why can't do?
Might be these mats we are getting, no? The pricking mats, what we can use.
Guasa is very specific. Guasa is very specific. See, there should be very proper scraping, right? With a 30 and 45 degree angle, then only this will affect. Okay.
Okay.
Yeah.
Okay. Thank you, sir.
Welcome. Yes, Dr. Babuji. Well, Dr. Yeah.
Good evening, doctor.
Very good evening.
Whatever you have done, guasa in the backside, whether it will cover cervical spondylitis, lower region pain, L4, L5 prolapse, everything it will be applicable, or some separate protocol is there? Yeah,
definitely separate protocol is there. But in that protocol, this is also there. Suppose someone is having the problem in the cervical vertebra, suffering with the cervical spondylosis, then this part will be there for sure. But we will also add more parts. So we will discuss them. Okay.
Okay, for inflammation, spondylitis also it can be done, no?
Yeah. So the thing is this: most of the people, most of the patients are not coming when they are having spondylitis. Okay, because spondylitis means little pain in the neck in the first time of the life. Then no one is going to the doctor. Then they are waiting, taking the painkiller, or pain is getting subsided automatically in 2 days. Then again they are getting the pain after a few days. So the patient is coming to us only when they are having chronic condition or the spondylosis. Okay, because it's true, if the patient is having inflammation, then we can't do. Okay, we can't do, because inflammation means already we can do on the correspondence area, but we can't do here. Okay, we can do on the palm, on the feet, or wherever we have cervical points. But if suppose we got injury, we can't do there. We got some accident and we are bleeding happened from the part, we can't do from here, from there. So we have to avoid that part, right? In the same way, if the very new inflammation, then we can't do on that part. Okay.
Okay, moreover, one thing, whether we have to take any caution, those who are affected by the syphilis, then AIDS patient, anything affected liver disorder like cirrhosis and
No, actually there is no such precaution, because Guasa is very easy method and very safe method, because even we are doing for the cirrhosis of the liver and all, we are just doing on the correspondence points. We are not focusing more locally. It's absolutely safe. We can do for all, and Guasa is not having such side effect. Okay, not like that. It's very safe.
Okay, thank you, very kind of.
Yeah. Yes, Roshan ji. Yeah.
सर फुट ड्रॉप में क्या कर सकते हैं हम लोग?
किसमें?
फुट ड्रॉप, मेरे पेशेंट है फुट ड्रॉप का।
हाँ, तो फुट अभी हम समझेंगे, है ना। अभी हमने सिर्फ एक ही समझा है कि लोअर पार्ट में करेंगे। तो अभी की नॉलेज से हम क्या करेंगे कि अगर कोई फुट ड्रॉप का पेशेंट आता है, यानी उसके कमर की नर्व
जी L4
तो लोअर पार्ट में तो कर ही देंगे, राइट। लेकिन अभी हम जब और स्कल्प का माइक्रो सिस्टम समझेंगे ना, तो वहां भी फुट का पॉइंट लगा देंगे, है ना, और पाम और फुट के भी फुट के पॉइंट लगा देंगे, तो हमारा एक बहुत ही बेहतरीन प्रोटोकॉल बन जाएगा। अभी तक की नॉलेज से हम लोअर पार्ट ऑफ द बैक में स्क्रैपिंग करेंगे, है ना।
थैंक यू वेरी मच सर।
जी वेलकम। गुरदीप जी, आपका माइक ठीक हुआ? नहीं हुआ माइक? आपका माइक सही हुआ क्या गुरदीप जी? गुरदीप जी, आपकी आवाज नहीं आ रही है। आपका माइक सही नहीं हुआ गुरदीप जी। यस प्रदीप जी, यस प्लीज।
हेलो, प्रणाम सर।
हाँ प्रणाम जी।
सर ये पूछना था कि ग्वासा आज जैसे कि हो सकता है उस आदमी को ज्यादा परेशानी है, तो क्या दूसरे दिन उस जगह पे निडल कर सकते हैं या मैग्नेट लगा सकते हैं?
कर सकते हैं निडल। मैंने वही बोला कि हम अगले दिन बुलाकर दूसरे ट्रीटमेंट तो कर सकते हैं, जैसे निडल कर सकते हैं, मैग्नेट कर सकते हैं, है ना। ग्वासा नहीं कर सकते और कपिंग नहीं कर सकते, लेकिन बाकी हम बाकी ट्रीटमेंट कर सकते हैं। जी बिल्कुल कर सकते हैं, कोई प्रॉब्लम नहीं है। हम क्यों नहीं कर सकते? क्योंकि एक ही पार्ट को रोज रोज स्क्रैपिंग नहीं कर सकते, स्किन में इरिटेबिलिटी होगी, है ना, इसलिए नहीं करना है बस। राइट। यस नीता जी। हाँ यस नीता जी के, हाँ अनम्यूट करिए अपने आप। हाँ अनम्यूट किया।
ओके, गुड इवनिंग।
वेरी गुड।
आपका डेमोन्स्ट्रेशन बहुत अच्छा था और आपने ये जो टूल्स यूज करे,
हाँ
आपने एक बार ही चेंज करा, 2 बार आपने चेंज करे, तो उनका कैसे डिफरेंस करेंगे अलग अलग? इज इट ऑन द बेसिस ऑफ द इंटेंसिटी ऑफ द पेन और इज इट बेस्ड ऑन द हाउ डज इट डिफर?
या आई विल टेल यू। तो क्या होता है कि हमने टूल मैंने इसलिए चेंज किया कि मुझे बताना था कि हम अलग अलग टूल का प्रयोग कर सकते हैं। आप चाहें तो सिर्फ एक ही टूल से पूरा ट्रीटमेंट कर सकते हो, ऐसा कोई मैंडेटरी नहीं है कि हमें टूल चेंज करना ही पड़े। हम एक ही टूल से भी पूरा ट्रीटमेंट कर सकते हैं। मैंने बताया कि वी आल्सो कैन यूज दिस। ओके, हमने कहा
डेप्थ का बात करी थी, बिकॉज़
हाँ मैंने कहा कि वो जैसे वो चम्मच है, काली वाली जो मोटी चम्मच है,
हाँ वो जो स्पून आपने बोला ज्यादा डेप्थ है, तो उसका इज इट रिलेटेड टू द इंटेंसिटी ऑफ द पेन?
जैसे ये वाली चम्मच जो है, दिस स्पून, ये थोड़ा डीपर मायोफेशियल स्टिमुलेशन देती है वाली स्पून।
राइट।
इसलिए हमने क्या किया कि हमने बताया कि अब आपको थोड़ा डीपर देना है तो इसको यूज कर लो, ये स्कूप है।
तो ये कौन से मतलब हाउ वुड वी असेस द पेन कि इसको
नहीं,
deep वाला
आप ऐसा मतलब आपको लगे ना कि यहाँ थोड़ा और करो तो आप तेज करो, तो इसको ले लेना, इससे बहुत तेज होगा। आपको मालूम नहीं है कि कई बार जब पेशेंट आते हैं ना तो पेशेंट बोलते हैं डॉक्टर साहब थोड़ा और प्रेशर दो ना, डॉक्टर साहब थोड़ा और प्रेशर दो ना, ऐसे बोलते हैं। जैसे उदाहरण के लिए एक दिन क्या हुआ कि मैंने किसी और से करवाया ग्वासा, तो बोलते हैं आपके हाथ में तो बिल्कुल मक्खन जैसा लगा है, डॉक्टर साहब जैसा दबाओ ना, ऐसा बोलते हैं पेशेंट। तो क्या होता है कि पेशेंट को चाहिए बिगरस है ना, कई पेशेंट को चाहिए बिगरस, उनको सही आराम होता है, उनको दबाओ अच्छी तरह से, उनकी मालिश करो, उनको ऐसे दबाओ, देन दे फील गुड। और कुछ लोगों को ऐसा होता है कि दे आर वेरी डेलिकेट, सो वी कैन जस्ट डू द वेरी जेंटल ग्वासा। ओके, कुछ लोग ऐसे होते हैं ना कि आपने रखा ना, आपको बड़ा आश्चर्य होगा कि मैंने तो स्क्रैप किया ही नहीं तो भी चिल्ला रहे हैं, देन यू हैव टू डू वेरी बेबी ग्वासा है ना। You will automatically feel when you start doing, आपको खुद ही समझ में आ जाएगा, पेशेंट ही आपको बता देगा डॉक्टर साहब इससे ज्यादा मत करना।
So would it vary with the skin if it is on the muscles or on the bone?
It's very with the comfort level of the patient. और बैक साइड में हम हमेशा थोड़ा डीप लेवल का ग्वासा कर ही सकते हैं। लाइक सपोज इफ यू वांट टू डू ऑन द बैक, यू कैन डू डीपर लेवल ग्वासा एज पर योर कैपेसिटी, एज पर द bearable capacity of the patient. There is no problem.
And the lubrication that we are using, should it be warm or it should be
no,
normal?
it should be normal, not the warm.
Not
when you do the gwasana, warmness will automatically come. After that you can touch and you will see the area become hot. आपको खुद ही लग जाएगा।
Because I have got it done using the coin once by somebody.
Coin से किया आपने?
Yes.
Yeah,
coin
that's wonderful. Okay, that's excellent. कोइन से भी कर सकते हैं यार, कोइन से तो गजब। मैं एक बार कहीं गया था तो वहां पर कुछ था ही नहीं ग्वासा कर इंस्ट्रूमेंट, इवन आई हैव डन विद अ कोइन। मेरे पास ₹1 का सिक्का था, उससे किया और पूरा दर्द चला गया। तो लोगों ने कहा
वेरी इफेक्टिव।
या इट्स वेरी इफेक्टिव, या
वेरी इफेक्टिव,
वंडरफुल,
थैंक यू, यू गेव अ वेरी गुड डेमोंस्ट्रेशन।
या थैंक यू। यस, श्वेता जी अनम्यूट करिए।
हेलो सर।
हेलो श्वेता जी।
Yeah. Sir, I wanted to ask that when we treat the patient according to the pattern, say like when there is kidney yin deficiency or liver yin deficiency, so there does, working on the liver organ or the kidney organ, does it increase the heat in the body? Because that will be a situation otherwise.
Actually, when we are, see, there are Leo connecting meridian in the human body, right? So what is the Leo connecting meridian? Leo, the meaning of Leo connecting meridians are, they are having 3 types of path. One path is very superficial, like the spider network. Okay, so when we are rubbing this gwasa, we are rubbing the Leo vessels, which is very superficial. Okay, so suppose here we are having large intestine 4 and we are doing the gwasa here on the large intestine 4. So you will ask, oh, we are doing the treatment on the surface, how it will work? Because when we are putting the needle is going inside. So how can you work with the surface? Because the Leo vessels of the large intestine will be even here. So this Guasa therapy more work, Guasa and cupping both works more on the Leo vessels. Okay, Leo vessels. Superficial, even suppose you want to do many person do the bloodletting, right? So when we do the bloodletting, our target just take out blood from the superficial line, not from the deeper level. Even it will give effect because we are working on the Leo vessels, which is highly superficial, not the deeper, and they will work.
Okay.
Right? Yeah.
So for kidney yin patient or liver yin patient also, we can just work on the organ area there, on the organ areas, and that will help the patient.
Yes, that will help, and in the both condition, it will help whether the yin or the yang condition. We have to choose the as per the organ wise in this way. Even we are doing as per the TCM protocol management, we are also doing So, but here we have done as per the correspondence part, right?
Right. Yeah.
Okay.
Very good explanation, sir.
Thank
Thank
you.
you so much. Yeah.
Yes, Begum ji.
Sir, good evening, sir.
Very good evening.
Sir, I want to share some experience.
Yeah, please.
See, I have seen one of your Guasa YouTube broadcasting.
Yeah.
In that you have used that Guasa. My sister from abroad, she came and she was severely affected with the neck pain.
Okay.
When she bent down, before she get up, she'll be just screaming of the pain.
Okay.
What I did this with the Guasa, I just saw your video and then I did as it is.
Okay.
See,
Wonderful.
miraculously, after just 5 minutes, I asked her to bend down and get up. She was so surprised, she didn't feel the pain at all.
Wonderful. So nice.
For the past 2-3 years, she was having this sharp pain. I too was just crying on her, shouting. See, when she bends down and get up, no, she used to cry. Like she will be holding that neck at the back, the yang side, and then she will be, I don't know how to explain her pain. That takes some shooting pain she was having.
Yeah.
But
Wonderful.
on seeing your video,
So where you
I just
where
tried
you have
whether
done?
I will be able.
Yeah, yeah. So in where
Back
you have
of the
done?
neck and the shoulder.
Okay, okay.
So actually, before now this
Yeah, yeah,
class, I
yeah,
didn't
yeah.
know which part to be done.
Yes,
Whichever part she told it's paining, I tried
Okay,
with
got
that
it. Got
oil.
it. Wonderful.
Yeah, with the oil, whichever part she was having pain, I just did guasa.
Okay, excellent.
Sorry.
Excellent.
Yes, it's a
Wonderful.
very good experience. Really, she was surprised. Within 2-3 minutes, not even 5 minutes, the pain is gone.
Wonderful. Thank you for sharing
Thank
your
you, sir.
experience. Thank you so much.
Thank you, sir. Thank you, sir.
Yeah. So this is a very wonderful experience shared by the Begum ji. And yeah, so these types of experience are inspiring everyone. Okay. So Gurdeep ji, आपका तो mic सही हुआ नहीं है ना? Gurdeep ji, हम okay. So where is Kamal ji? Kamal Bensit ji, where are you? Kamal ji, Kamal ji. Yeah, yeah. Unmute yourself, please. Unmute. Kamal ji.
Can you hear me now?
Yeah, yeah.
Hi, good evening, everyone. Yeah, I'm just wondering if we could do ourselves the
Yes,
guasha.
yes. Yeah, definitely. We can
I
do
mean,
for
there is some limitation with me because I will try whatever I could.
no,
yeah.
whether we do for others or for ourselves, there is no problem. Even we can do for ourselves. There is a good.
Well, I need to give an example. I have to do it myself to feel better, flexible. Then we can do, trust me,
Yes.
Otherwise they think I'm a woo-woo doctor, So what I'm saying, that's one. Secondly, this is very important to hear, this question. If somebody has issues with like clots, thrombosis, and vascular issue, yeah? So how do the guasha at the back could help or to avoid scrapping?
See, the person is having suppose the person is having some very serious condition on certain body part. So don't do on that part. Suppose someone is having clot somewhere, don't touch that part. Do on the correspondence part. For example, if the person is having common cold and flu, so we are not touching the nose, but we are doing in the upper back. We are doing in the upper back, right? So in that way, the person is having clot somewhere. So why to touch the local part? Why to irritate the local part? We can do. Someone is having clot in the legs, so we can do in the lower back as we discussed today. Okay. So in this way, it's not necessary to do the guasa where we have pain. Okay, we can do. Even suppose someone is telling, can you treat my headache here? You can do the guasa here. Can you treat my neck pain? You can do the guasa there. But some person is telling you, can you treat my blood clot in the brain? It's not mandatory to do on the brain. You can do on the correspondence area wherever we are discussing the brain is, right?
Right. So can you do it on the finger? This is like a insect finger, yeah?
So we are going to discuss the points here, even on the feet. So definitely we will do the guasa there.
Oh, that's very good. That's good. Yeah.
Yeah.
Thank you so much for your time and everything.
Welcome. Yes, Saraswati ji.
Namaste, sir.
Namaste.
Sir, for treating the thyroid, we can choose that hairline to neck part, sir.
Yeah, so for treating the thyroid, we have to treat the hairline to neck, even the upper part, because thyroid is connected with here. So we have to go on the back side, but thyroid is also connected with the heart and with the lungs both, right? So see, as per the concept of TCM, if you want to treat the thyroid, so you also have to increase the energy, yang energy in the body, right? I'm talking about the hypothyroidism. So thyroid is in our syllabus, so we will discuss the complete protocol. So wait for that. We are going to discuss.
And for muscle stiffness, we can treat the lower back pain, sir. On that area means which part I have to treat? Number 5, that
so we
below
we can do for the lower back muscle spasm, we can do locally, and even we will do here. So that in the next class we will learn these microsystem in the detail. So in the next class we will discuss skull microsystem in the detail. So wherever you are having pain, you like even the muscle spasm in the lower back. So we will do number 1 in the lower back, number 2 in the scalp, on the hairline, even in the vertical line. So that will be very good.
Okay, sir. The class was amazing, sir. Excellent.
Yeah, thank you so much.
Thank you, sir. Thank you.
So all the questions are over, or anyone left? I think over. So thank you so much, everyone. Okay, Roshan ji, you want to ask? Yeah, Roshan ji, yes, please.
पेशेंट को बिठा के कर सकते हैं क्या?
हाँ, आप बिठा के, लेटा के, खड़े किसी भी पोजीशन में कर सकते हैं. There is no problem.
L4 L5 में तो करना भी पॉसिबल होता नहीं मेरे ख्याल से.
नहीं, आप कर सकते हैं उसको खड़े होके थोड़ा आगे बैठ करके लेटा के भी कर सकते हैं. कर सकते, any position which is comfortable. Yeah. Gurdeep ji, आपको
Right now, yeah, I told you I'm studying this seriously because of this damn COVID is going to ruin is coming back again, and it's very serious as well. They thought he will stay here just at the bronchus level, but now he will go down to it can cause pneumonia. Anyway, what I'm trying to learn this is a specific, just massage. You don't need a needle, you don't need any drugs, nothing. All you have to do, I'm sharing this with you. So all you have to do is here, because the virus entered from here. But here, when you do the massage, sorry, I have to.
Yeah, so so that's why we are discussing the formula of flu, COVID, and common cold. Even we are going to discuss lungs, pneumonia, and all. So we have to, if we do on the correspondence point of the lungs, what we are discussing and what we discussed in the previous class, even we can fight with these all types of flu, including COVID. Okay, it's a wonderful formula for improving the immunity and even for treating the pain. Okay, in both conditions. Right? Okay, Gurdeep ji, आपका माइक ठीक हुआ? नहीं हुआ. Okay, no problem. आपकी आवाज नहीं आ रही है, सॉरी. और आप अगर ऐसा कभी हो तो आप चैट बॉक्स में भी लिख सकते हैं, तो हम चैट बॉक्स से पढ़ के भी आपको जवाब दे सकते हैं. राइट, तो अभी आज की क्लास को यहाँ पर समाप्त करते हैं. और so let's close the session today. Now see you in the next class. Thank you so much. Closing now.